I'm going to talk about an article that came out, a study that came out on the effectiveness of spinal manipulation therapy in treating spinal pain. This was in the journal Orthopedic and Sports Physical Therapy back in January of 2025. And they were exploring, the different types of manual manipulative therapy on spine pain, back pain, neck pain, whatever, different parts of the body. And it, what they were, the big question they were getting at was, how much does the procedure type you pick, given what you have learned over the years, how much does that matter when you're just looking at outcomes? And it's just, it was a big, long, was a big meta-analysis, systemic review, and what they were. This is something that I've started to notice. I've been practicing for quite a while now, almost getting close to 20 years, and the longer I've practiced, the more I've realized that kind of how I treat the patient does not matter nearly as much as the relationship that I am able to build with the patient, and establishing that rapport to, in the beginning, as early as possible, to build a level of trust and comfort with the person. And what they kind of had found in the study, looking at 161 different trials around spinal manipulative therapy, is number one, spinal manipulative therapies do have slightly more positive effect than other treatment modalities. Okay, so as a whole, not any one particular spinal manipulative therapy, so that's important to remember, but as a whole, the whole toolbox of those that physical therapist or chiropractor or whoever else can deliver that kind of treatment may have, they're pretty effective, or not pretty effective, slightly more effective than their treatment options. And you'll find that their effectiveness is actually pretty low power anyway, but that's a whole different discussion. But some of the interesting things that they found is, it seems that comparing different procedures, and sorry, I'm looking at notes over the side, but comparing different types of manipulative procedures, the effects are small or insignificant depending on which ones people are using. So an instrument adjustment or manipulative therapy, hands-on, high velocity, low velocity, whatever it may be, the differences in clinical outcomes between all of them is pretty irrelevant and insignificant. And what's interesting, this is something that I started to note, longer I practiced, is that the more general and non-specific the approach, there was the higher probability of getting the largest effect and outcome on the patient dealing with spine pain than compared to, hello Brazil, than compared to people trying to be targeted and specific. And if you, like me, or a chiropractor, or if you're a physical therapist, they spend a lot of time in clinic when you're going through school, harping on specificity and trying to deliver this perfect adjustment at the perfect place at the perfect time. And in the end, the longer you practice, the more you realize that doesn't really matter that much. And this kind of bears it out. And through the research, is the more the people that were just general and non-specific in their approach to spinal manipulative therapy, and just not even really concerning themselves with the particular place that the patient says is bothering them that much, that may not really matter, because the best effects and outcomes we're seeing in people taking the most general approach to working on the spine. So, they were just, kind of the main comment in the end is that it doesn't seem to matter that much, which approach you're taking. The things that seem to matter the most are the approach that is preferred by the provider and the patient, that the provider and the patient are both comfortable with the approach being taken, and that everyone is confident in the utilization of that preferred approach. So, any preferences, any differences between clinicians appear to be small. So, so you just have to realize that the main thing, the main thing is patient relationship, because in 90% of cases of spine pain, a clinician can't reliably identify specific causes anyway. So this challenges, that in itself challenges the very idea of being specific and trying to find that vertebral level that needs to have this perfect, treatment to it, and that a non-specific approach that's more general in nature is going to probably be more effective, because as a clinician, in the end, you really don't have a clue exactly what's causing the pain anyway. So it's best to educate the patient on just general improvements in motion of the entire spine will probably help reduce their symptoms and pain levels, and don't get too caught up on trying to adjust or manipulate C6 to get rid of that neck pain. So that just means that when I was in chiropractic school, people were always very diligent to make sure that you were identifying the exact spot, and that might not be that necessary. So this just means that we may have to shift how we think about the training of spinal manipulative therapies in schools, because right now that specificity is a very big piece of how you're trained. And when I was being trained, that was definitely a big part of it back in 2007. So you just have to make sure that what makes the most sense for you and the patient, and given the relationship you have with the patient and how much confidence you've given that patient your ability to make the right decision, to utilize tools that are going to be safe and effective, and to make sure that you're just keeping the patient comfortable, and you will get good results regardless of what specific option you're using. The goal is really to have a broad toolbox, so that way you can shift between approaches depending on how a person's responding easily, and be quick to tell a person, hey, we're not quite getting where we need to go with this approach, so I've got some of these other but that's my preferred approach, but I've got some of these other approaches that I think may also be helpful. And so we're going to just kind of shift course for a little bit and see if we start heading in the right direction. And if you have a good rapport and a good relationship with that patient, they'll just be just fine taking that ride with you, because they trust that you are thinking about them, thinking about their problem, and thinking about ways that you may be able to change approaches if the patient doesn't feel like they're getting the outcome that they want. So, in the end, as that clinician, you just have to get comfortable in understanding that. You need to realize that spinal manipulative procedures are going to work, but they're how they work is not really that well known, and whichever approach you use will probably be fine. You don't have to get too caught in the weeds. So, general non-specific approaches work great. You're going to get improvements working on area, even if that's not the area of complaint. You see this when you work with enough people, that sometimes their neck pain starts to resolve while you're manipulating their mid-back, and there's, a tensegrity to the area, how everything is connected kind of makes some, helps that, because you'll notice that, how things are connected through the back, through the different musculature and the joints and the ligaments, improving movement and motion, kind of anywhere along there can have, effects up or downstream of the place you're working on. So, just make sure that you don't get too stuck on one single approach, that general inputs to the spine can have effects across the whole thing. And in the end, the relationship between you and the patient is what's most important. And if that is maintained well, how you approach the care as long as everyone's comfortable with what's happening and the approach is safe and effective, you're going to create good improvements. So I hope that helps you guys. Maybe talk about this further in a different day. Check my, subscribe to my channel if you want. There's lots of other stuff on there, and talk to you later.